Okay, thank you very much for your kind invitation to this webinar to speak about HIFU and fertility. Okay, the first thing I want to point out about the uterine fibroids, apart from the fact that they are very prevalent and cause significant morbidity in women, is that there is enough evidence about their negative impact on fertility. And this infertility associated with fibroids occurs by different mechanisms that have been described by some authors, such as anatomic distortion of the uterine cavity, and increased uterine contractility, impairment of the endometrial and myometrial blood supply, and hormonal changes induced by fibroids, which could impair gamete transport. Okay, but on the other hand, we must also take into account the age factor because, as you know, the age remains the single most important determinant of human fertility. Modern societies have changed rapidly, and currently there is a tendency to delay childbearing beyond the age of 32 years, mainly in Western countries. And this situation, combined with the increase of fibroids with age, leads us to a new scenario, which is the large number of older patients with fibroids and problems conceiving. And the advances in new reproductive technologies cannot compensate for this issue. This is a serious problem. The effect on fertility impairment depends on the location of the fibroid. This is clear. There is evidence that patients with submucosal myomas and intramural myomas distorting the uterine cavity have the most significant impact. On the other hand, some authors support the idea that intramural fibroids greater than 4 centimeters, even without cavity distortion, may also negatively influence fertility. In fact, there are many studies focused on association between this type of fibroid and in vitro fertilization outcomes. In this line, some publications like this systematic review or meta-analysis conclude that this type of fibroids, even small size, over 2 centimeters, really impact adversely on IF outcomes. However, it also concludes that there is still no definite evidence to indicate routine myomectomy in these cases. We strongly believe that HIFU therapy, but its non-invasive nature, could be a good treatment option for these patients. But okay, it's something that we have yet to demonstrate with some prospective randomized studies. On the other hand, when women get pregnant despite the uterine fibroid, they are subject to specific pregnancy complications, such as premature delivery, placental abruption, placenta previa, and abnormal fetal position, and other complications. In terms of treatment, there is currently a large arsenal of available treatments, from classic excisional procedures to occlusive procedures, and of course, ablative procedures such as radiofrequency ablation and high-intensity focused ultrasound. Even though so much variety of treatments, nowadays myomectomy is still considered the gold standard for women with symptomatic fibroids who wish to become pregnant. Surgery to remove fibroids seems to improve fertility, especially in submucosal fibroids. Anyway, if you look at the literature, one wonders if that is really true. This is Cochrane review of 2020 that concludes that there is no evidence for a significant effect on the clinical pregnancy rate after myomectomy of an intramural or submucosal fibroid. This is not my opinion, it's published evidence. Nevertheless, there's enough evidence about complications associated with myomectomy. Hemorrhage and blood transfusion, organ injury. It can cause pelvic adhesions that may increase the risk of infertility and cause a uterine scar, delaying the time of gestation and increasing the risk of uterine rupture. Okay, what can HIFU offer to these patients? Surely many of you already know that HIFU is an emerging and non-invasive technique for the conservative treatment of solid tumors. In 2002, Professor Wang reported that ultrasound-guided HIFU was safe and effective in treating uterine fibroids. In 2004, FDA approved HIFU for the treatment of uterine fibroids. In 2019, the National Institute for Health and Care Excellence approved HIFU technique and published a medical guidance on ultrasound guide HIFU with evidence-based recommendations. In the same year, the SG Working Group on Non-Surgical Ablative Therapy of Benign Uterine Disease was created, of which our HIFU unit played an active role. Okay, according to the Focus Ultrasound Foundation, right now, over 128,000 women with uterine fibroids have been treated throughout the world with great success. Okay, in respect of the therapeutic principles, the ultrasound waves are delivered by therapeutic transducer, and they travel safely through adjacent tissues to reach deep into the focal spot. Suddenly, a small area of selected tissue is heated between 70 to 90 degrees and is destroyed. Focal spot is guided by real-time ultrasound imaging. The safety of the treatment is based on its great precision to treat tumors. This is supported by several studies of pathological anatomy that demonstrate a coagulative necrosis with clear and sharp boundary between treated region and non-treated region. Okay, and this is the result of HIFU treatment. On the left, you can see the images before sonication, and on the right are images after treatment that show hyperechogenic changes at the top and a non-perfused volume of 100%, on contrast enhanced ultrasound and on contrast enhanced MRI. In relation to fertility, HIFU safely and effectively achieves ablation of uterine fibroids without damaging the surrounding myometrium, which conserves its biomechanical properties of tension and contractility. HIFU also preserves ovarian and endometrial function. We have some studies that show no significant difference between the anti-Mullerian hormone levels before and after treatment, with no amenorrheic patients after the procedure and with no symptoms suggestive of menopause after treatment. In this other prospective study from the last year, Melkozerova et al. Observed no significant changes in molecular and tissue markers of endometrial receptivity in women undergoing HIFU ablation for uterine fibroids. The objectives of HIFU ablation of uterine fibroids in women with gestational desire are, on the one hand, to achieve the inactivation of the hormonal and vascular function of fibroids. On the other hand, to shrink them in order to normalize the uterine anatomy. Both things seek to increase the chances of obtaining a safe pregnancy without complications of the surgery. Well, we already have several publications with good pregnancy outcomes after HIFU treatment, large series of 80, 100, and up to 130 pregnancies after HIFU with high gestation rates. The conclusions of all the authors are the same. Full-term pregnancies with a normal delivery and without complications are possible after HIFU, and there are no rare cases of uterine rupture or abnormal placentation. Okay, I'm going briefly to talk about our experience with the HIFU technique and the pregnancy outcomes. And I take this opportunity to congratulate my team at the Mutua Terrassa HIFU unit in Barcelona for the recent publication of our work. In our retrospective study, we include 560 women with symptomatic uterine fibroids who underwent ultrasound guide HIFU between February 2008 and February 2018. 71 pregnancies of 55 patients have been obtained, which is, to our knowledge, the longest series of pregnancies after HIFU treatment in a Western country. The pregnancy rate was 34%, which is similar to or better than after laparoscopic or laparotomy myomectomy, and higher or lower than that after hysteroscopic myomectomy, depending on the study. Among the 71 pregnancies, there were 43 deliveries, including a natural twin gestation, 22 first trimester spontaneous abortions, and 6 therapeutic abortions for personal reasons. As you can see in this table, the incidence of cesarean section was low. It was 43%, which was much lower than in patients undergoing myomectomy or uterine artery embolization, or in those reported by other authors after ultrasound-guided HIFU. Regarding the characteristics of 43 successful deliveries achieved after HIFU, the rate of full-term deliveries was 91%. Therefore, the rate of preterm delivery was 9%, only in 4 cases, which is lower than in the series of pregnancies with untreated fibroids or pregnancies following UAE. The mean birth weight of the 44 newborns was 3 kilograms. 7 of them were low birth weight infants, these that you can see here, except for the 1.4 kilogram baby who was born with a previously diagnosed tetralogy of Fallot and intrauterine growth restriction. The remaining newborns, 98%, developed well without complications during postpartum and breastfeeding. The complications detected during pregnancy were 1 case of first trimester bleeding, 1 preterm labor, 1 renal colic caused by growth of the myoma, 2 cases of placenta previa, and 2 cases of preterm premature rupture of membranes. The intrapartum and postpartum complications reported include 3 retained placenta with manual removal, 1 of which received red blood cell transfusion, 1 case of severe preeclampsia that ended in forceps-assisted delivery at 37 weeks, and 2 cases of emergency cesarean section for fetal bradycardia and for hemorrhage associated with placenta previa. It should be known that this series had no cases of uterine rupture or placenta accreta, which can occur after myomectomy or UAE. Regarding the clinical outcomes of the treatment in the 55 women who became pregnant, HIFU ablation was followed by substantial shrinkage of the ablated fibroids with significant symptom improvement. We must highlight that these results were achieved in women with a medium maximum diameter of treated fibroids of 6.4 centimeters and a non-perfused volume ratio of 76%, which is higher than that reported in most series of HIFU treatment. Only 5 minor complications were observed. This in 1 patient. The 10 centimeter fibroid treated was almost completely expelled from the vagina 6 months after HIFU ablation. Another patient had vaginal discharge of the treated fibroid 2 months after HIFU. 1 patient had first-degree skin burn, and 2 patients had self-limited hematuria. No major complications such as bowel or bladder injury or nerve damage occurred, and no patients developed amenorrhea after HIFU ablation. Then I'm going to present some interesting cases. This is a 30-year-old woman with a previous premature labor with hypermenorrhea and anemia, severe anemia, and secondary sterility. As you can see, she had a transmural fibroid of 10 centimeters. It is hypointense, very good case, and has low vascularization. This is a very big fibroid, but with 2 good characteristics to respond to HIFU. Okay, we achieve a complete ablation. You can see 100% ablated. And this is image, you can see the great non-perfused volume. MRI 6 months later showed a reduction in the size of the fibroid to 2 centimeters. Just then, the patient underwent a hysteroscopic resection of the remaining myoma fragment. And this is the hysteroscopic video after HIFU and surgery showing a normal uterine cavity. The woman became pregnant spontaneously 3 months later and gave birth to a healthy baby weighing 3.5 kilograms. This is a 33-year-old nulliparous woman with hypointense submucosal fibroid of 6 centimeters and hypermenorrhea. You can see the myoma occupying the whole uterine cavity here, type 0, type 1, with high vascularization, this on the right, and small areas here and here, small areas of low vascularization. Contrast-enhanced image immediately after HIFU showed an unperfused volume of 100%. 6 months later, the myoma completely disappeared with restoration of normal uterine anatomy. This patient achieved 2 full-term spontaneous pregnancies that ended in uncomplicated vaginal deliveries at 38 and 37 weeks. Okay, a few words about adenomyosis. We know from different publications that adenomyosis is an important cause of infertility, and that treatment is a great challenge for the gynecologist. Adenomyomectomy is very aggressive for the uterus, and this type of surgery carries subsequent obstetric risks that we cannot ignore, or surgical risks. Okay. Severe hemorrhage with subsequent emergency hysterectomy, and when the women get pregnant, it's possible the uterine rupture and some risk like this. The results from this meta-analysis show that HIFU is effective for the treatment of adenomyosis, reducing the uterine volume at 12 months, reducing dysmenorrhea at 3 and 12 months, and improving the quality of life at 6 and 12 months. Adverse reactions after HIFU were reported in 56% of patients, which were grade A or minor complications. There are still few studies on pregnancy outcome after HIFU treatment for adenomyosis, but the results are quite encouraging. In this study, 68 patients with adenomyosis who wished to get pregnancies were treated with HIFU ablation. 54 patients got pregnancy at the median of 10 months after HIFU, and 21 of them had delivered healthy babies. No uterine rupture occurred during gestation or delivery. Dysmenorrhea and menorrhagia in the patients who had pregnancies after HIFU were significantly relieved. In this other study from the last year, 93 patients with adenomyosis and infertility were included. 50 were treated with HIFU and 43 underwent laparoscopic excision. The most important conclusion of the study was that patients treated with HIFU showed significantly higher pregnancy rates and natural conception rates than those who underwent laparoscopic surgery. You can see here a pregnancy rate of 52% in the HIFU group versus 30% in the laparoscopic group, 40% of natural conception versus 80% in the laparoscopic group. As a conclusion or message to take home, uterine fibroids and adenomyosis can negatively affect fertility and increase the specific risk of specific pregnancy complications. And myomectomy and adenomyomectomy have some disadvantages that we have considered, especially in women who have decided to conceive. According to our experience, ultrasound-guided HIFU therapy is an effective and safe treatment for uterine fibroids. Ultrasound-guided HIFU makes it possible to obtain full-term pregnancies with few intrapartum or postpartum complications in patients with benign uterine pathology. And due to its non-invasive nature, it should be the first therapeutic option in women with uterine fibroids and gestational desire, with many disadvantages over myomectomy. And of course, we need prospective randomized studies to confirm these observations. And okay, that's it. Thank you very much for your attention. If you have some questions.
Yeah. Thank you for your beautiful presentation. We are very much appreciate your contribution.
You're welcome.
Maybe first question from me. Cesarean rate in fibroid 43%, and adenomyosis you showed cesarean rate is 67%. Why there is some difference in cesarean rate in between fibroid and adenomyosis?
Cesarean, sorry, the cesarean
rate in case of fibroid, you showed 43%.
In my series, yeah.
And adenomyosis 67%.
After HIFU.
After fibroid and adenomyosis, there is some difference in cesarean rate. Why?
After cesarean rate after in adenomyosis after HIFU treatment is 67%. Okay. It's a very good question to. It's difficult to answer this question, and it's difficult probably because in the group of patients with adenomyosis, the incidence or the prevalence, the incidence of sterility is very high. And it's probably these patients, when they achieved a pregnancy after in vitro fertilization, is very difficult to achieve pregnancy after adenomyosis. And probably this group of patients wants to have a very safe delivery, and probably for personal reasons, these patients wants to have a shorter cesarean section to avoid some problems of the vaginal delivery. Perhaps, I don't know. This is a possible reason. But it's difficult to know why.
Thank you for your explanation. And is there any question? So, okay. How many cycles? So, how many cycles of HIFU treatment required for adenomyosis? How about interval between treatment? There is a question.
But it's with one session of treatment is enough to have good results in adenomyosis. Only one time. But and you can repeat this treatment 1, 2, 3 years after the first treatment if the adenomyosis recruitment is okay, appear newly, but for the first time we can treat in one session the whole adenomyosis. And okay, we can, and the patient can get pregnant 3-6 months after treatment with no problems. I cannot demonstrate this because we don't have studies, but probably if we wait 3 months, 6 months is enough to get pregnant.
Maybe.
Yes,
maybe
I
another
can read.
Question, maybe for adenomyosis, do you use GnRH
Yeah, we used 3 months of GnRH analogs before treatment.
Pre-treatment.
Yeah,
Okay.
in all cases.
Okay.